Let's discuss the 5 transporting points, Yin spring points, Heart 8, the Lesser Palace. Location on the palm between the 4th and 5th metacarpal bones. How to find when making a fist. Heart 8 is generally located below the tip of the little finger in the depression between the 4th and 5th metacarpal bones. Heart 8 often lies between the two transverse palmar creases. It is often sensitive to pressure. PC8 is also located on the palm, generally below the tip of the middle finger when making a fist, between the 2nd and 3rd metacarpal bones. Needling vertically 0.5 to 1 tune. Caution, needling this point may be painful. Provide a competitive stimulus by pressing the palm with fingernails close to the point before inserting the needle. Ask the patient to breathe out during needle insertion. Action indication, it clears heat in the heart and small intestine, regulates the heart qi for liver qi stagnation, calms the shen and strengthens the heart qi, opens the channel especially for contractures of the fingers. Special features, Yin spring point, fire point, bend point, 5 paces. Heart 8 is a stronger point than Heart 7 Shenmen. Its main action is to clear heat in the heart, whether it is full heat, empty heat, or heat with phlegm. Its main range of action is therefore in excess patterns of the heart. The main symptoms would be insomnia with restless dreams, thirst, bitter taste, mental restlessness, or hypomania. Dark urine, tongue ulcers, and red tongue with redder tip and yellow coating. Heart 8 also calms the mind, but mostly in the context of excess pattern with heat in the heart. Heart 8 influences the bladder via the small intestine to which the bladder is connected within the greater yang. For this reason, it affects urination and can be used for difficult urination and enuresis. As the heart is connected to the kidneys via the lesser yin, the heart channel may influence the kidney channel in the genital area, and for this reason, this point can treat itching of the genitals from heat. The explanation of the acupuncture points says that Heart 8 is reduced to drain fire in urinary problems. As the heart is connected to the uterus through the uterus vessel, Baomai, Heart 8 can be used to lift sinking qi causing prolapse of the uterus. The text and explanation of the acupuncture points says that in order to lift sinking qi in prolapse of the uterus, this point should be reinforced. Heart 8 clears heart fire, heart empty heat, and heart phlegm fire. It calms the mind in palpitations, sadness, worry, chest pain, agitation, mental restlessness. Benefits the bladder in difficult urination, enuresis. It regulates the uterus and lifts sinking qi in prolapse of uterus. Heart 8 is the yin spring and the point of the heart Xiao Yin, lesser yin channel. Hence the name Lesser Palace. According to the classic of difficulties, yin spring points are indicated for heat in the body, while a saying of Chinese medicine states, when the heart is cleared of heat, the urine will flow. Heart 8 is a major point for clearing heart fire, which transmits to the hand, Taiyang, small intestine channel, its exteriorly coupled channel, and tends to the foot Taiyang bladder channel paired with small intestine according to 6-channel theory, giving rise to a variety of urogenital symptoms, including difficult urination, enuresis, and itching or pain of the genitals. The characteristic accompanying signs of this type of urogenital disorder are insomnia, emotional disturbance, thirst, and sores of the mouth and tongue. Although having some action of clearing heart fire, affecting the upper jaw in this way, Heart 8 is traditionally less indicated for this purpose than points such as PC7 and PC8, and its primary application is to clear the lower jaw heat. The second principal action of Heart 8 is to regulate the heart chi in cases both of stagnation and deficiency. Stagnation of chi in the heart and chest region, principally transmitted from the liver and due to emotional factors, may present as pain and oppression of the chest, accompanied by excessive sighing, fearfulness, and even plumstone, chi globus hystericus. All indications classically recorded for this point. Equally, Heart 8 is indicated for a variety of emotional disorders due to deficiency of heart chi. This kind of deficiency, which often follows severe emotional shock or fright, may give rise to palpitation, sadness and worry, heart and lung chi deficiency, or excessive fearfulness, heart and gallbladder chi deficiency, as well as excessive sighing, which, although more commonly due to chi stagnation, may also result from chi deficiency. Heart 8 is indicated for a variety of heart channel disorders, including throat pain, stiff tongue, contracture of the elbow and axilla, and especially heat in the palms and contracture and pain of the little finger. Finally, according to the essential questions, the Baumai uterine channel pertains to the heart and is connected with the uterus. Heart 8 is indicated for and appears in classical combination for uterine prolapse. Thank you for your attention.
Let's discuss LI4 joining valley, one of the 5 command points. LI4 is located on the radial aspect of the hand between the first and second metacarpal bones, closer to the second metacarpal bone and approximately at its midpoint. How to find LI4? When pressing the thumb and index finger together, the adductor pollicis and the interosseous dorsalis muscles will form a bulge. Needle LI4 at the highest point of the bulge and push it further towards the inferior aspect of the second metacarpal bone. Or spread the thumb and forefinger and place the distal phalanx of the thumb of the other hand on the webbed border. When flexing the thumb, its tip will point to LI4, or insertion on the angle bisector between the first and second metacarpal bones, needling in the direction of the midpoint of the second metacarpal bone. Needling of LI4, 0.5 to 1 Sun vertically or slightly obliquely towards the palmar aspect of the hand. Caution: reducing needle techniques are contraindicated during pregnancy. Exception: to induce labor. Actions or indications: releases exterior. This is actually the main point, to release the exterior. Regulates face and head, regulates defensive chi or wei chi and sweating. Opens the channel and luo connecting vessels, alleviates pain, promotes labor. Special features: Yuan-source point, Gaowu command point for the head and mouth, Madanyang heavenly star point, entry point according to some authors. LI4 is the most important analgesic point for the whole body. The most important single distal point for disorders of the face and sensory organs. It is the most commonly used point in clinical practice. The combined bilateral needling of LI4 and liver 3 between the second and third metatarsal bones is known as 4 gates. They strongly regulate chi and blood, stop pain, and relieve spasms. LI4 is one of the classic points of acupuncture. As a Yuan-source point, its connection with the origin is harmonizing and regulating for body, mind, and spirit, relieving anxiety. The great self-regulating capacity of Yuan-source points helps balance the large intestine, either when it has become bogged down in the mundanities of life, seeing only the coal face and never the diamonds, the endless practicalities of life, or when at other times, large intestine has become detached from the world, walled in by memories, resentments, or perhaps too deficient in energy to move on in life. When out of balance, large intestine can find it hard to connect with others, even when help is needed. The instinct to do it their way and be defensive can lead to tension, often exhibited along the pathway as well as in behavior. This can be eased by LI4's connection with the Yuan Qi, allowing LI to relax and move. It strengthens Qi and Wei or defensive Qi. LI4 is a powerful point. As the entry point, it invigorates and regulates LI meridian and Fu. When pain originates from the intestines or areas traversed by the Yangming channel, LI4 can act as a powerful antispasmodic muscle relaxant. Combination of LI4 with LI4 is known as the four gates and is commonly used to treat pain, spasm, and tension of body, mind, and spirit. LI4's ability to move and tonify the blood can strengthen muscular tension along LI channel and strengthen atrophied muscles. The name Great Eliminator indicates function of the large intestine, not just at the physical level, but also at the level of mind and spirit, wherever the system has become blocked, constipated, and toxic. It can help restore imbalance, showing as over-refining, verbal diarrhea, or endless pedantry. Like lung 7, LI4 can prompt an emotional release, but it engenders calm, equanimity, and regularity of the automated rhythmic processes of life that, under the aegis of the Po, keep us in harmony with life. LI4 is sometimes called the command point of the face and mouth. This meridian directly affects the face and sense organs. LI4 is often used as a distal point for mouth, nose, and eye problems on the face pertaining to the Yangming channel, often combined with LI20. LI4 is a major point to release to exterior, clearing heat, wind heat, and fevers. It strengthens dispersing action of the lungs to release exterior and expel wind, and is often combined with lung 7 to clear external wind. LI4 is one of the 9 needles for returning yang, so is used as a revival point after a yang collapse. It harmonizes ascending of yang and descending of yin, recalling the power of metal to balance, and can be used to balance ascending rebellious qi of the stomach, lung, or liver, or to raise sinking qi. LI4 was included by Ma Danyang, the great physician of the Jin dynasty, among the 11 heavenly star points, his grouping of the most vital acupuncture points, and was indicated by him for headache, swelling of the face, malaria with chills and fever, tooth decay, nosebleed, and lockjaw with inability to speak. The Ming Dynasty author Cao Wu, in his work Glorious Anthology of Acupuncture and Moxibustion, also recognized the supreme importance of LI4 and included it among his 4 command points for the face and mouth. Some hundreds of years later, it is still probably the best known and most commonly used of the acupuncture points. LI4 is a primary point to expel wind cold or wind heat and to release exterior. It may be useful in this respect to view the yang LI channel as the exterior reflection of the yin lung channel with which it is coupled. The lung dominates exterior by virtue of its function of controlling skin and body hair and spreading the defensive qi. Attacked by exterior pathogenic wind cold or wind heat, which disrupts the exterior portion of the lung system, therefore, may be treated via the points of the LI channel, most notably by LI4. Thus, the Great Compendium of Acupuncture and Moxibustion recommends this point for injury by cold, headache, rigid spine, and absence of sweating. This is the classic presentation of wind cold binding the exterior portion of the body. The basic principle in Chinese medicine for the treatment of this condition is to release exterior by inducing sweating, thereby expelling the pathogen along with the sweat and facilitating circulation of defensive qi. In fact, LI4 may also be used for injury by any exterior pathogenic factor, which is accompanied by sweating, in this case, pathological sweating, which does not serve to expel pathogenic factor. This dual action of LI4 on both inducing and stopping sweating is reflected by the advice given in the Great Compendium of Acupuncture in Moxibustion to reinforce LI4 and reduce kidney 7 if there is no sweating, and to reduce LI4 and reinforce kidney 7 in cases with copious sweating. The explanation of this apparently contradictory function is that LI4 is able to regulate defensive qi and hence adjust the pores, whatever the pattern. Indeed, some authorities go so far as to attribute to LI4 the ability to tonify the defensive qi. Thank you so much for your attention.
Let's now discuss two more extra points, namely Yuyao of fish waist and Taiyang, the supreme yang. First, we have Yuyao. This point is located in the center of the eyebrow, with the eyes looking straight ahead directly above the pupil. How do this point? With the patient looking straight ahead, palpate the eyebrow directly above the pupil, superior to the supraorbital ridge. There locate EXHN4 or Yuyao in a small depression on the superciliary arch. Needling this point is 0.3 to 0.5 tune vertically or obliquely towards the eye. Its actions or indications include benefits the eyes and dispels pain. Yuyao is used for eye disorders such as blurred vision or floaters, particularly deriving from liver blood deficiency. It is also a useful local point for headaches from liver yang rising when they occur behind one eye. It also treats dull headaches from liver blood deficiency occurring behind both eyes. To summarize its functions, Yuyao subdues liver yang in cases of headache behind the eyes, dizziness, and blurred vision, and also brightens the eyes in cases of redness, swelling, and pain of the eyes, blurred vision, twitching of eyelids, and drooping eyelids. This point first appeared in the Classic of the Jade Dragon. In clinical practice, it is mostly selected in the treatment of supraorbital pain and diseases of the eyes and eyelids, and is stimulated by through needling from either yang by or GB14 and bladder 2. Next point we have here, supreme yang or Taiyang, or the EXHN5 point. This is located on the temple in a depression approximately 1 tune lateral to the midpoint of the line connecting the lateral extremity of the eyebrow and the outer canthus of the eye. So how do we find this point? On the temple, first draw a line between the lateral extremity of the eyebrow and the outer canthus of the eye. Next, palpate from the midpoint of this line in a lateral direction until you can feel a distinct depression in the temporal bone. EXHN5 or Taiyang is located in the center of this depression. This point tends to be pressure sensitive, especially with temporal headaches, and patients often get relief by using acupressure on this point. Needling Taiyang is 0.5 to 0.6 tune vertical insertion into the temporal muscle or obliquely in a lateral direction or transversely towards GB8. This point often bleeds when needled, so prick to bleed to drain heat. For its actions or indications, Taiyang eliminates wind, clears heat, reduces swelling, opens the channel, and alleviates pain. Special features. Taiyang is one of the most important and most commonly used extra points, especially with headaches. Taiyang is frequently used as a local point for headaches due to rising of the liver yang or liver fire when the headache occur on the temple. It can also be used for eye problems due to heat, either exterior as in wind heat or interior as in liver fire. So to summarize its functions, Taiyang subdues liver yang in one-sided headache on the temple, dizziness, and tinnitus. It also brightens the eyes in blurred vision, redness and swelling of the eye, and pain in the eyes. Taiyang is one of the most important and commonly used of the extra points. It was first discussed in the sage-like prescriptions from the Taiping era, the 10th century CE. Although considering its importance in the martial arts tradition as a vital spot where a blow may be fatal, it was almost certainly known much earlier than this date. Taiyang is commonly needled or pricked to bleed in two clinical situations. First, in the treatment of one-sided headaches and dizziness, in which case it is frequently joined to GB8. And second, in the treatment of diseases of the eyes such as redness, swelling, and pain. The Ode to the Jade Dragon recommends bleeding bilateral Taiyang for dimness of vision, and also, surprisingly, needling it in combination with SI1 for swelling of the breasts. Taiyang can be used in combination with other acupuncture points for the following disorders or illnesses. For disorders of the eyes, Taiyang can be combined with bladder 1 and Yuyao or MHN7, according to the Ode of the Jade Dragon. For redness, swelling, and unbearable pain of both eyes with photophobia. Bladder 1 can be needled with Yuyao, and Taiyang is bleed. This is according to Song of the Jade Dragon. For swelling of the breast, we use Taiyang and SI1, still according to the Ode of the Jade Dragon. Thank you for your attention.
Let's continue with the back transporting points. Bladder 44, spirit hot. Location 3, tune lateral to the posterior midline on the level of the lower border of the spinous process of the fifth thoracic vertebra, T5. How to find? After locating the spinous process of C7, count down 5 spinous processes to the lower border of the spinous process of T5. Located on this level and 3 tune lateral to the midline is bladder 44, or with the patient seated and their shoulder in a relaxed position, the spinous process of T3 is generally on the level of the medial end of the scapular spine, an easily palpable structure. Locate bladder 44 by counting down to the level of the lower border of the spinous process of T5 and measure 3 tune lateral to the midline. Located on the same level, do 11 on the midline, a point of EXB2, 0.5 tune lateral to the midline, and bladder 15, 1.5 tune lateral to the midline. Needling, obliquely 0.3 to 0.8 tune. Caution, pneumothorax. Action indication, bladder 44 regulates the upper burner and binds the chest, opens the channel, and alleviates pain. Bladder 44 is most commonly used for emotional and psychological problems related to the heart. It is best used in conjunction with bladder 15 for anxiety, insomnia, and depression. Bladder 44 strengthens and calms the mind, stimulates the mind's clarity and intelligence. It lives in a long time, over 15 minutes. It left in a long time, over 15 minutes. It calms the mind and clears heart fire. Calms the mind for depression, insomnia, anxiety, mental restlessness, sadness, grief, worry. It also subdues rebellious chi for cough, wheezing, breathlessness, difficulty in swallowing, fullness of the chest. Despite the compelling name of this point, Hall of the Spirit, and the fact that bladder 44 lies on the outer bladder channel at the level of bladder 15, the back shoe point of the heart, there are no apparent references in any of the important classics of acupuncture to the use of this point for the treatment of emotional or psychological disorders. According to the essential questions, the 5 outer bladder points level with the 5 sang back shoe points, that is bladder 42, bladder 44, bladder 47, bladder 49, bladder 52, drain heat from the 5 sang, and action shared by the back shoe points of the 5 sang. Combinations: esophageal constriction, bladder 44, liver 4. Located on a level with bladder 15, the back shoe point of the heart, this point accesses the place where the spirit of the heart, the Shen, reside. In health, the Shen radiate through our eyes, our complexion, and in the condition of the blood. Shen informs our intelligence and our appropriate responses to situations. Spirit hall, where the spirit of the heart may be approached, is mostly used when the mind and spirit are disturbed by anxiety, deep lack of joy, or loss of enthusiasm for life, insomnia, blood deficiency, heartbreak, and heart problems. If the person is left in a state of heart shock, defeated with no protection, if the Shen are disturbed, then this point can restore the role of overseeing and control to the heart. Restore the calm necessary for the Shen to reside in the heart and encourage the person to participate in and feel the richness of life. It clears the mind and consciousness. On a physical level, it expands and relaxes the chest, invigorates the meridian, and eases pain. Get in touch with the spirit of the heart when a person is suffering from shock, feeling downhearted, hard-hearted, broken-hearted, disheartened, lacking in joy, or experiencing sadness. For long-standing grief over bereavement, loss of love, broken ideals, or where the patient has been deeply wounded emotionally. Using this point is like taking the patient into a hall where the spirit resides. As practitioner of this subtle and wonderful medicine, we need to work on being in touch with our own spirit when addressing any point, but particularly spirit points. Considering using alongside bladder 42, its name goes back in antiquity to the first century BCE. Thank you for your attention.
We will continue discussing the points of the primary channel of the large intestine. Okay, for general location, the course of the line connecting LI5 and LI11, which is 12 Chun, changes depending on whether the forearm is in a supinated or a pronated position. For location purposes, the forearm should be in a mid position with the elbow slightly flexed. Since the LI channel crosses to the opposite side of the body at DU26, at the nasolabial groove, locate LI19 and LI20 contralaterally. The LI channel of the hand Yang Ming is exteriorly coupled with the lung channel of hand Taiyang and paired with the stomach channel of foot Yang Ming according to 6-channel theory. The large intestine-lung relationship is further strengthened by the fact that both the interior pathway of the large intestine channel as well as the large intestine divergent channel enter the lung zan. The large intestine luo connecting channel from LI6 joins with the lung channel. In addition, it is clinically valuable to note that the large intestine primary channel enters the gums of the lower teeth. The LI primary channel crosses to the contralateral side of the face at DU26. The LI sinew channel ascends to the corner of the forehead and crosses over the top of the head to connect with the opposite mandible. The LI luo connecting channel enters the ear as well as the teeth. The LI divergent channel descends to the breast. The LI sinew channel attaches to the upper thoracic spine, and the divergent channel travels medially to the spinal column. The function of the LI4 is to receive waste material sent down from the small intestine, absorb its fluid content, and form the remainder into feces to be excreted. Despite this, although several points of the LI channel have an action on the intestines and lower abdomen, particularly in the treatment of borborygmus and diarrhea, in clinical practice, they are considerably less used than points of the spleen and stomach channels. Also, there is no LI channel point indicated for difficult defecation or constipation. This paucity of LI indications is not surprising in view of the fact that whilst the channel traverses the upper body, the fu lies in the lower abdomen. According to the spiritual pivot, Yangming channel is abundant in qi and blood. Points of both the arm and leg portions of Yangming channel are therefore much used clinically to regulate qi and blood in the limbs and treat atrophy disorder and painful obstruction, hemiplegia, and pain of all kinds. In the Chinese tradition, the sage faces south, and thus the light and warmth of the sun fall on the front of the body. The Yangming channels on the anterior of the limbs receive the full intensity of the sun, as does the abdominal and chest portion of the foot Yangming stomach channel, the only Yang channel to run along the anterior of the body. For this reason, Yangming or Yang brightness is considered to be particularly replete with Yang qi. Points of the LI channel, therefore, are among the most important points to clear excess of yang in the form of heat and fever, notably LI4 and LI11. Apart from the ones mentioned, the primary actions and indications of the points of the LI channel can be summarized as treating all disorders of the Yangming channel in the head. This area includes the face and cheeks, forehead, eyes, nose, lips, gums, and teeth. Treating disorders of the ear via the LI luo connecting channel. Expelling wind, cold, and heat from the exterior portion of the body. Clearing wind heat, interior heat, and fire poison from the areas traversed by the channel, especially in the head. Clearing Yangming fire, which disturbs the heart and spirit, assisting the lung in its function of opening the water passages. So finally, we have the target areas of the large intestine channel. Thank you for your attention.
Let's continue our discussion on location methods and tune measurements. Today we discuss on the neck. First, we have the laryngeal prominence. In men, the laryngeal prominence, as the highest point of the larynx or the Adam's apple, tends to form a clearly palpable and visible structure. In women, visual identification is more difficult, so that palpation is necessary in order to locate the V-shaped incisure on the upper border of the thyroid cartilage on the laryngeal midline. Located at the level of the laryngeal prominence are stomach 9, LI18, and SI16. Next, we have the sternocleidomastoid muscle. This muscle forms a distinct, easily identifiable structure on the anterior and lateral aspect of the neck, which becomes visible and palpable by rotating the neck in the opposite direction. This effect can be increased by rotating the head against resistance by pushing against the chin, for example. The more slender clavicular head originates from the anterior aspect of the manubrium, while the more flat clavicular head originates from the medial third of the clavicle, revealing a small triangle between the two heads near the sternoclavicular joint. This is the location of stomach 11. By palpating along the sternocleidomastoid muscle in a superior direction, the two heads can be distinguished for the major part of the muscle before they merge to insert at the posterior part of the mastoid process and the lateral superior nuchal line of the occiput. Besides ST11, the following points are located alongside the muscle belly of the sternocleidomastoid muscle: LI17, LI18, SI16, stomach 9, GB12, and anion. Here are illustrations showing the sternocleidomastoid and the laryngeal prominence and the acupuncture points near these landmarks, particularly the anion, GB12, stomach 9, which is near the laryngeal prominence, and also showing the auricular nerve, the major occipital nerve, the jugular vein, and the transverse cervical nerve, where the sternocleidomastoid is located. Thank you for your attention.
We continue with the window of heaven points. TB16 window of heaven. Location at the posterior border of the sternocleidomastoid muscle, directly inferior to the mastoid process on the level of the mandibular angle. How to find? For a better definition of the sternocleidomastoid muscle, ask the patient to rotate their head against a resistance towards the side to be needled. Tripole burner 16 is located on the level of the mandibular angle on the dorsal aspect of the sternocleidomastoid muscle. This point is located inferior to the posterior border of the mastoid. GB12 is located directly posterior and inferior to the mastoid. SI17 is also located on the level of the mandibular angle, but on the anterior border of the sternocleidomastoid muscle. Needling vertically 0.5 to 1 tune. Caution, carotid artery. Actions, indications. TB16 benefits the head and sensory organs. Descends the chi, expels wind. Opens the channel and alleviates pain. Special features, window of heaven point. TB16 is a window of heaven point, and all its action and indications reflect this nature. One of the main characteristics of this point is that they regulate the ascending and descending of qi to and from the head. They can therefore both subdue rebellious qi from the head and promote the ascending of clear qi to the head. The first action is reflected in this point's function in treating headache and dizziness from liver-yang rising. The second action is reflected in this point's ability to brighten the sense orifices by promoting the ascending of clear qi to them. Regulates the ascending and descending of qi and subdues rebellious qi. In headache, dizziness, swollen face, scrofula. Brightens the sense orifices. In sudden deafness, blurred vision, excessive lacrimation, sneezing, nosebleed, loss of sense of smell. Sanjiao 16 is one of the 5 points referred to in chapter 21 of the spiritual pivot as points of the window of heaven. And in this passage, it said sudden deafness with excessive qi, dimness of vision and hearing, select Sanjiao 16. Sanjiao 16, window of heaven, in fact, gave this group of points its name. In this commentary on the above passage, the points of the orifices of the head and face are like the great windows of a high pavilion by virtue of which qi moves. When there is inversion of qi below, the channels in the upper region do not move and there is lack of clarity of vision and hearing. In common with the other points of the window of heaven, Sanjiao 16 is able to regulate and balance the qi between the head and the body, and is indicated when inversion of qi, the chaotic and rebellious qi, rushes to the head. This gives rise to such symptoms as headache and dizziness, sudden onset of deafness, swelling of the face, and disorders of the eyes and nose. Also in common with other window of heaven points, Sanjiao 16 treats scrupula. All windows of heaven refresh the senses of the meridian in which they reside. The tree heater works ceaselessly to maintain and regulate the environment of the other officials. It is a mediator, and it is so important that this harmonious environment is maintained that we have a front move alarm point in each of the three jiao to check that all is well. How important it is then that the triple heater sees clearly, without contamination or prejudice at every level of body, mind, and spirit. If not, there will be loss of easy communication, the senses and spirit will be dulled. Irritability and agitation will fester. The neck acts as a bridge to the heavenly aspect of being and our senses. Free flow between head and body is necessary, otherwise our dreams, thoughts, senses, and all responsibilities of the tree heater become disturbed. If a person feels trapped by darkness, closed off from love, feels a long-term lack of joy, and as little optimism about the future, celestial window can act as revelation. Sometimes the reason to use the window is that the official has been working very hard and just need deep refreshment of the spirit. Heavenly window will allow the body, mind, and spirit to sparkle and feels enthusiasm again. On the physical level, the portals or senses of the head are windows. That means the communication with others and the world, both in expressing ourselves, nourishing our spirit via our senses, as well as receiving from others. This point brightens the senses on a physical level as well. Heavenly window can free the chi, promote a uplift of spirit, and harmony within the body, mind, and spirit, which helps shift and clarify the perspective and enable freer communication. As a window of the sky, this is a wonderful point for lifting the spirit if sadness or lack of joy is present in a person's life. Furthermore, it can help bring back to them a sense of purpose, perspective, enthusiasm, and clarity. This is the third point of the Sanjiao Meridian with heavenly in its name, indicating its influence in a person's relationship with their higher self. Thank you for your attention.
Let's now discuss lung heat and lung phlegm heat patterns under common cold and influenza. So this is at the chi level yet. Lung heat, clinical manifestations, high fever, feeling of heat, cough, breathlessness, coughing of yellow sputum, thirst, restlessness, and sweating. Tongue is red with yellow coating. Pulse overflowing and rapid. This pattern occurs when the external wind heat changes into interior heat and enters the lungs. So that's why we have the lung heat. From a Western point of view, acute bronchitis following a common cold or influenza is an example of such a pattern. Treatment principle, clear lung heat, prevent injury of yin by heat. Points, lung 10, lung 5, lung 1, do 14, spleen 6, all needled with reducing method. Lung 10 clears lung heat. Lung 5 resolves phlegm heat from the lungs. Lung 1 clears lung heat. Do 14 clears heat. Spleen 6 to stop sweating and prevent injury of yin by heat. Next, we go to lung phlegm heat. Clinical manifestations, high fever, feeling of heat, restlessness, thirst, vomiting after drinking, cough, breathlessness, pain in the chest, coughing of profuse amounts of yellow sticky sputum, feeling of oppression of the chest, nausea, dry stools, dark urine. Tongue, red with a sticky yellow coating. Pulse, slippery and rapid. This pattern is similar to the previous one, insofar as there is lung heat, but also phlegm heat. Treatment principle: clear lung heat, resolve phlegm, restore the descending of lung qi, and prevent injury of yin. Points: lung 5, lung 1, stomach 40, REN 22, PC6, spleen 6, and 214. Reducing method, except on spleen 6, which should be reinforced. Lung 5 resolves phlegm heat from the lungs. Lung 1 clears lung heat. Stomach 40 resolves phlegm and stimulates descending of lung qi. Pericardium 6 opens the chest. Spleen 6 helps to clear heat by nourishing yin. And 214 to clear heat and is used if there is a high fever. Thank you so much for your attention.